Diagnostic Tools in Gynecology by Dr. Nareman Alhammamy. Diagnostic Tools in Gynecology. We will talk today about the tools used in gynecological diagnosis. Firstly, we will talk about ultrasound, abdominal ultrasound and transvaginal ultrasound. Second, we will talk about endoscopic methods, which include laparoscopy, hysteroscopy, colposcopy, and exfoliative cytology. Regarding the ultrasound base is about sound. Sound is transmitted through a media. So the ultrasound, the human ear can hear sound waves of frequencies from 20 to 2000 hertz. When the sound wave have frequency more than this sound, this called ultrasound waves. So the ultrasound waves, it's a sound above the ear can hear. The value of ultrasound in gynecology, the value is everything. Everything you can do by ultrasound in gynecology. I mean, when I'm talking about the diagnosis, we can diagnose congenital anomalies, diagnosis of stercogonads, diagnosis of Mullerian disorder as agenesis or abnormal fusion, diagnosis of uterine atresia or hypoplasia, diagnosis of hematocolpus, diagnosis of associated urinary anomalies. We can diagnose all the congenital anomalies, almost all the congenital anomalies by ultrasound. We can also assess the adnexal mass, diagnosis of polycystic ovary syndrome, investigation of postmenopausal bleeding, investigation of menorrhagia. We can do folliculometry, evaluation of pelvic pain, screening of pelvic cancer. All these things I can do with the ultrasound. We can also use the ultrasound in gynecology in the diagnosis of traumatic lesion, the position of missed intrauterine device. When a patient comes to you with saying, I can't reach the threads of the IUD, I don't know where my IUD device, my IUD device, where by very simple maneuver like ultrasound, you can know the position of the missed IUD. Assessment of cesarean scar. Nowadays, the cesarean section is worldwide spread, and we need to know the cesarean scar thickness before next pregnancy or during the real pregnancy to assess the pressure of the baby on the previous scar. Diagnosis of postoperative pelvic or abdominal wall hematoma. Hematoma in general, we can assess the hematoma in general, which appear very clearly by ultrasound. In oncology, we can diagnose pelvic tumors, like uterine fibroids, ovarian mass, uterine polyp, vaginal tumor, diagnosis of spread of malignancy. All of these were diagnostic tools. We are talking about the therapeutic value. We can use the ultrasound in ovum retrieval for assisted reproductive technology for aspiration of different pelvic cysts. You can see now the shape of the different probes of ultrasound and the keyboard of the ultrasound. When we use transabdominal ultrasound, we need empty bladder, we need verbal consent from the patient that we will do transabdominal ultrasound. We need a female attendance when you are a male gynecologist. We need a private place. We need to know the brief gynecological history before putting our machine. We need to know the brief gynecological history. When we use transvaginal ultrasound, we need empty bladder, transvaginal probe penetration in transvaginal probe introducing to the vagina. We will rotate the transvaginal probe 45 to 20 degree to assess the pelvic organs. The ultrasound is simple and easy maneuver. We can use it for the diagnosis of many things, but it still have drawbacks. The drawbacks of ultrasound, we can't use the ultrasound inversions. We can't use the ultrasound early postmenopausal. We can't penetrate the ultrasound in post-radiation stenosis. We can't use it in children. We can't use it when the female have psychic sexual disorders. The penetration is so difficult. This picture shows a normal non-pregnant uterus on transvaginal ultrasound, and this illustration shows a transvaginal ultrasound image and how I put the transvaginal ultrasound and rotate it through the pelvis to see the pelvis. The next picture, which shows which have ectopic pregnancy, which is pregnancy outside the uterine cavity. As you see, the uterus is empty above the gestational sac. This is picture of polycystic ovary. The picture show multicystic ovaries, not single cyst. It's multicystic ovaries. It's called polycystic ovary disease. This picture shows the molar pregnancy. Molar pregnancy means the uterus is full of vesicles. This illustration shows the anomalies of the uterus. This is illustration. We can use the ultrasound to see this illustration, especially the 4D ultrasound. This is in brief about ultrasound. The second method for as a diagnostic tool in gynecology is the endoscopic method. The laparoscopy. The gynecological laparoscopy is an alternative to open surgery. Instead of doing a surgery, instead of cutting the anterior abdominal wall, we can do holes in the anterior abdominal wall and going in by laparoscopy. Laparoscopy can be used for diagnosis, treatment, or both. A diagnostic procedure can sometimes turn into treatment. I am doing the diagnostic now, and when I see something to be treated, I will not come out and treat it in another set. I will treat it in this set. We can use some reasons for diagnostic laparoscopy are unexplained pelvic pain, unexplained infertility, a history of pelvic infection, and many other things. This is just an example for the diagnostic laparoscopy. Conditions that might be diagnosed using laparoscopy include endometriosis, uterine fibroid, ovarian cyst or ovarian tumor, ectopic pregnancy, pelvic abscess or pus, pelvic adhesion or pelvic scar tissue, infertility, pelvic inflammatory disease, reproductive cancers. Advances in laparoscopy. The new in laparoscopy is the robotic surgery. The robotic surgery is sometimes used for gynecological laparoscopy. The robotic arms are steadier than human hands. They may also be better at fine manipulation. Micro laparoscopy is a newer approach. Instead of the large laparoscopy and the large balls, we now use a micro laparoscopy for the diagnosis. But laparoscopy still have many risks. Risk of laparoscopy, skin irritation and bladder infection are common side effects. More serious complications are rare. However, they include damage of the abdominal wall vessels, nerve damage, allergic reaction, adhesions, blood clots, problems with urination. But actually this is rare. Laparoscopy is a golden tool in the diagnosis of gynecological problems, and as I said, this is a brief notes about endoscopy, about laparoscopy. The other item is hysteroscopy. It's an endoscopic method also for viewing the interior of the cervical and uterine cavity. Now we are not in the abdominal wall like laparoscopy, we are inside the uterine cavity, inside the cervical and uterine cavity. Indication of hysteroscopy: abdominal PAP test result, abdominal uterine bleeding, abnormal BAP test. Abnormal BAP test. The BAP test is screening of the cervix. When I have abnormal BAP test, this will need to be more invasive, and I want to know what is inside the cervical canal and what is inside the uterine cavity. Abnormal uterine bleeding after menopause, diagnosis the cause of infertility, examine and remove uterine scarring or polyps or fibroids, remove small tissue polyps or biopsy, removal of endometrial lining. What are the risks of hysteroscopy? Some possible complications of hysteroscopy may include infection, bleeding, pelvic inflammation, tear of the uterus, complication from fluid gas. These are rare complications nowadays, and these complications depends on the hands of the surgeon. You may have slight vaginal bleeding and cramp for days or two after the procedure. This is normal event, not a complication. When you do a hysteroscopy for a patient and the patient coming 2 days after complaining of vaginal bleeding or abdominal cramps, this is so normal. This is not a complication. This is so normal. Regarding the colposcopy is stereoscopic binocular low power microscope. It's a difficult name, but you can simply say it's a microscope. A microscope that permit 6 to 40 power magnification of the cervix. The colposcopy is used to examine the lower genital tract, but it doesn't enter the vagina as its focal length is 20 centimeters. Another thing is the exfoliative cytology, the study of the individual cells which shed from the surface of various epithelial types, and we will examine it by the pathology. Before I finish this diagnostic tool lecture, I want to say that there is also diagnostic tools like plain X-ray. We can use plain X-ray on the abdomen or pelvis to know where is missed iodine, for example. But the ultrasound now is more accurate, but I can't leave the plain X-ray. We can use now MRI, magnetic resonance imaging for cancers, for uterine fibroids, for invasion of the placenta accreta. We can use CT, but I still have my notification about the CT. It's less accurate in ovarian masses. The most accurate in ovarian masses, especially when it's full of fluids or full of blood, is the ultrasound. So ultrasound, then laparoscopy, then hysteroscopy, then colposcopy. This is the most golden tools in the diagnosis of gynecology. And thank you very much.